Afternoon, everyone. So our next terminology is HCD, that is Hyperreflective Crystalline Deposits. These are basically OCT findings which are seen in non-neovascular AMD. So this you can see as a very hyperreflective line just below the RP and above the Brex membrane. Clinically, it appears like a very brilliant yellow lesion, just like refractile drusense. And in IR images, these are highly reflective like a mirror. And these are supposed to be made of cholesterol crystals, and they do not produce any shadows. These are very similar to the onion peel sign, which is explained in exudative AMD, where the cholesterol crystals comes from the exudation of neovascular component, whereas in HCD, which is typically described in non-neovascular cases, this is basically due to the debris. And even though clinically it appears very similar to refractile drusense, the OCT is entirely different. In this picture, we can see both drusense and HCD together. The lesion 1 and 2 are refractile drusen, where we can see a heterogeneous internal reflectivity with a hyperreflective cap, whereas HCDs are like linear structures. Two interesting artifacts are described in HCDs. One is a linear artifact in which we can see a vertical linear hyperreflective line just above the HCD, and this is supposed to be due to saturation artifact. And it is better seen in pseudocolor images. And the other one is an artifact which is seen in octa. Like at the level of HCD, we can see a false flow signal, and this is mainly due to variability of the reflectivity because of the cholesterol crystals. And once we see an HCD in OCT, we should be following this because they can undergo remodeling, like they may move, they may become fragmented, and sometimes they may completely clear up. And whatever, the remodeling of HCD is usually associated with serora expansion. This picture, we can see that the HCD that was detected in the initial picture, they become fragmented and completely resorb with an increase in the serora. Another picture in this, we can see the HCD later became fragmented. Then in the third picture, we can see that there's an RPE break at the site where HCD was present and little bit of SRF. Later, this HCD completely disappeared with a small lacunae there, some minimal SRF or a vacant space. So, altogether, HCDs have got a macular complication, mainly increase in the serora, and other complications are macular neovascularization, RPE apertures, and macular hole formation. So, in a nutshell, HCD is hyperreflective crystalline deposits. They are cholesterol in nature, seen in non-neovascular AMD, like they are very bright and they do not produce any shadow. And the problem with the HCD is the remodeling can be associated with a serora expansion. So altogether, if you see a HCD in a wet AMD, it carries a negative prognosis. That's it. Thank you.
Thank you, Dr. Rejina. So if you see something hyperreflective, if it's not a vitelliform, if it's not onion peel, and it's along the Brooks, just call it HCD and move on with life. Okay. So with this, we'll end the session. Thank you to the panel and the speakers. We are not breaking for lunch, so finish your banana chips, and I'll hand over to Dr. Unni.
Thank you, sir. Let us have some visual and auditory relaxation before our next session. Enjoy the seasons.